Yeah.
You haven't drank much water, have you, today?
Oh, he hasn't touched it since today.
That's so fun, isn't it?
Yeah,
You want a drink, Wes?
he hasn't been eating either. I'm just getting more and more worried about him.
How are you feeling, Wes? You don't look too well. You're not feeling very well this morning? No? No, he doesn't look well. I think I should maybe go and get the nurse. Yeah, should we get the nurse in? Let me just go and ask if the nurse is free.
It's alright, though.
Phil, can you just walk away just for a minute? Is that alright?
No time.
Hello, hi, I'm Bill.
Oh,
Yeah.
yeah. Phil,
So, this is the help.
isn't it too well?
Hello, Liz. My name's Bill. I'm going to be helping Liz look after you. Tell me what's going on. I hear that, mate. Look, we're going to get you fixed up, okay? Let's get a set of obs, Liz. Alright.
Yeah, I'll go and
I'll stop you while you're doing that. Things been getting a lot worse at home.
Yeah, it's just absolutely shit. We're only in and out of hospital, stuff like this, but it's nothing severe. It's kind of shocking a bit, so
We're going to get a set of obs, okay? And see how he's getting on, yeah, thanks.
I'm just going to put this blood pressure cuff on you. Is that alright now, Wes? And just get a set of obs, see what's going on, eh? Yeah, definitely doesn't look as well as yesterday. Thank you.
Just going to pop this on your finger, like. I know you've got a bit of shape there, haven't you?
I'm just going to set
Try
your
not
blood
Dear.
Wes, I'm just going to count your breaths for a minute, okay? So I'm just going to go quiet while I count them,
So
alright?
tell me what's happening the last time you was in hospital. Was it kind of a similar sort of presentation, but not quite as bad?
Yeah, it was
for a drug check.
similar
We'll
to
be there soon, sorry.
last week. Sorry, similar to last week, but yeah, he's constantly trying to get a breath of air,
Yeah.
coughing and stuff, and we did.
And
that
was he coughing anything up?
I think he's this
Oh, so, 87.
pink frothy stuff.
Oh, dear.
But he hasn't in the last like half hour.
Okay. Yeah, I'm going to start you on some oxygen, alright? Good man. Just put this on your nose. There you go, lovely. Well done. So, I'm losing my glasses. There we are. So, put on 2 litres to start with, okay? Lovely.
Rest to 25, just do his temperature. Just do your temperature there, Wes. Okay. So, rest to 25, temperature 36.5, SAT's 87,
That's not so reassuring.
and blood pressure 150/75, so he's scoring a 6.
A 6. Okay, well, I think we'll get the doctor to come and see Wes. Is that okay? Is that alright, Wes? We're going to get the doctor to come and see you. They might want to do a couple of tests, but we'll see what they say. I might even phone the AI as well.
Yeah.
We'll be back in a minute, alright?
Do you reckon he's going to be okay?
Well, we hope so. We hope so. We're going to give him all that treatment he probably had last time, but it sounds like it's just that original illness is just getting worse again. Perhaps we didn't get on top of it enough before he went home. We'll do our best for him, don't you worry. Alright, don't worry. Hi guys, sorry to have kept you so long. I'm so busy at the moment. Hiya Wes, I'm back. It's Bill, remember? Alright, we'll come and just hopefully have a quick look at you.
Not doing too well.
What are the odds?
SAT's still
The SAT's-
90 on the
Not come up with the oxygen.
Come up a little bit, not much. SAT's normally 97, 98.
Right, okay. I think probably we'll start them on that non-rebreathe on 15 litres. So if you disconnect the 2 litres via the nasal cannula,
Yeah,
I'll pop this mask on them.
Take that one off, plug
Yeah.
this one in.
Lovely, thanks Liz. That's good, great. Okay, so I'm going to examine you now, Wes, but first of all I'm going to put this oxygen on all the way to the top, please, Liz. Thank you. Just going to take this off, my friend. Well done. That's it. Lovely. All right. So hopefully this won't be too tight. You tell us if it is, though, won't you? Is that okay? Yeah, it won't be for long, I hope. So he's talking, his airway's okay. I'm going to do a full AKI assessment, alright. If you could stay, I'm going to ask you a few questions, but let's just get this door shut. Alright. Okay, so airway's okay. Let's have a look at his breathing. So what's his respiratory?
It was 25. Do you want me to do another set?
Would you? Do you mind? That would be great. Thanks. Sorry to be a pain. There you go. Oh, you got.
Count your breaths again now.
Oh yeah. Oh, that is a bit bloody, isn't it? Okay, mate. Thanks for letting me know. We'll have a look at. We'll maybe get a sample or something like that. All right. So I'm just going to have a little listen to your chest, please. All right. Let's sit you forward. Well done. Just breathe as normally as you can. Alright, let's get you sat up a little bit, shall we? I think if we sit him up, just going up a little bit. Well done. You're doing great. Okay, superb. That might help a little bit more. Alright. Just going to check your chest. Yeah, that looks symmetrical. Just check this look here. Yeah. Alright.
Respiratory.
Yeah, he's quite dull in the bases, so I think there's some fluid there.
Gonna bring your blood pressure again now.
Like what the doctors call water tablets.
Just gonna go in tight.
Alright, okay. Thank you. Gonna have a little feel of your pulse.
No, I don't want to do this anymore. No,
That voice and stuff
I
like that.
don't want to go on anymore.
Don't worry,
I
we're
want to
not.
go.
Oh, let's put that back on. That's slipping a little bit.
Keep the mask on.
Well
I don't want to do it no
Oh my
more.
gosh. Pulse is quite irregular.
Yeah, it's quite high.
I think maybe we'll get an ECG. We'll get hold of that. I'm not sure if it's on the ward still.
It uses 8.
Right.
You know,
Have you been doing some training recently? Have you?
Yeah.
Excellent. Right.
It's come back.
Would you like to get some blood stuff as well? And just all the 4 usual bottles. Yeah, and a form and stuff. And let's have a look at you taking some blood. Is that okay?
Yes.
Excellent. Oh, that's so good. All right. Now I'm going to have a little listen to your heart as well, just to see if there's any murmurs or anything. You're doing great. Well done. That's an awful cough, isn't it?
Still ECG machines in use. Do you want to get a BM and then I'll go get the blood?
Yeah, let's get a beer. Lovely, thank you.
His cough just keeps getting worse.
What was it like last time you was in hospital? Was it the same sort of thing?
It was similar, but it wasn't the same.
Alright, so he's getting a little bit tired of it, doesn't he?
Yeah.
Wait, I'm just going to check your blood sugar, alright? Just to prick on your finger. I'm going to get
I
a
don't really know.
It's
I
hard to
just know
know.
a little bit of the because he always.
Alright, okay. So he's had multiple admissions this year?
Yeah. Just last week we were ill for a similar thing.
Right.
Oh, sorry.
Well done, well done. Just going to press on your chest, my friend. This for 5 seconds. 4, 5. Well, that's 2. That's good. That's really good. Okay.
BM 7.
But his heart rate is quite irregular. That blood sugar's normal. That's good. Okay, so we've got a normal cap refill. Blood pressure is about. Was it still about
It's about
150?
155 over 70.
Right, 150 is just all. That hasn't changed. That's good as well. Right, I think we've got a BM. I've got a pen torch. Oh yeah, I've got it. So I'm just going to have a quick look at your eyes. Hang on a second. Well done. That's it. You did great. Well done. So they're going to start properly. All right. He's getting quite tired. I can see that. He's probably as conscious that he's not going to respond as well as he normally does, just because of what's going on. I'm sorry. Now, I'm going to have a quick look at your body, especially your legs, if that's all right. Okay. I'm just going to pull these covers back a little bit. Is that all right? Good man. Right, let's have a quick look. Oh, right, okay. Have they always been that swollen, do you know? Because they are quite swollen. Right. So you see when I press on there?
Yeah.
And it stays pressed in the skin?
God, yeah.
That's what we call fitting edema. Now, Let's have a look at how high that goes up. Right, that's going up to his bum, basically up to his sacrum, we call it.
Right.
All right. That's not a great sign, but we have got medicines that can sometimes help with that.
Right.
Now, it does look like your heart's not working as well as it could, Wes. Your heart rate's very irregular, but we knew you had AF already. However, you're not getting rid of that fluid as well as you could. Let me have a quick look at your catheter bag.
Doctors will have me fixed in no time.
Okay, mate. So,
Don't say that, Bob.
are you getting sick of things?
I don't want to go anymore.
Well, you know, we have to take your point of view into account, Wes. You're a grown man, all right, and you know what you're talking about. He's not confused or anything. Have you noticed anything? No. Has he been like this before? Did you get quite down? And
Not really, not like this.
not like this. Probably all those aggressions. He's getting a bit sick of it, isn't he?
Yeah.
Yeah.
I don't want to lose him.
No, of course not. Neither do we. Look, it always seems worse at the first when you're first in hospital, and hopefully we can get on top of these symptoms nice and quickly. We're going to get some medicine for you, all right, my friend? But first of all, I think we'll probably do another set of ops, and just to see, hopefully that oxygen's helped a little bit, etc. Is that okay? Won't be a second, I'll just get some stuff. Would you like the door open or closed?
Just a bit open.
It's a bit more than you, isn't it?
You're through to the acute intervention team.
Hi, acute intervention team. This is Bill on the acute medical unit. Can I discuss a patient with you, please?
Yeah, sure, go ahead.
Okay, so I have a 79-year-old gentleman called Wesley Crusher. He has been suffering with shortness of breath at home, so much so that he's had to come into hospital.
Right.
He's got a background of ischemic heart disease, heart failure, atrial fibrillation, and he takes medications for those. Those medications, however, were stopped on his last admission, which was last week. He's a failed discharge. On examination, we found that his airway was patent. However, he was quite tachypneic. Originally, his respiratory rate was 25, but it's steadily climbing. When we listened to his chest, he had crackles, widespread crackles really, but reduced air entry in both bases. On percussion, he was resonant in the upper zones, but dull in the lower zones. Symmetrical breathing, his trachea is central. We started him on 2 litres of oxygen, but he didn't respond too well to that. SATs were 87 at that point, so we've got him on 15 litres, and the saturations are steadily climbing, but kind of plateauing a bit now. In C, he had a normal cap refill time, systolic BP 155. Heart rate was variable. He's irregularly irregular, so I don't know if his AF is well controlled. He's still waiting for an ECG. He's not passed much urine today. As far as I'm concerned, he has an acute kidney injury from his urine output. He's basically been anureic in the last 6 hours. However, on his blood results, so that shows AKI as well. Actually, I forgot to tell you, in B, he also has been expectorating frothy bloodstained sputum. In C, we also have done some bloods, and as I said on his previous bloods, he had an acute kidney injury. He's apyrexial, so we don't think there's any sort of septic picture going on here, just heart failure. However, in D, his blood sugar was 7, pupils equal and reacting to light. We may have to tinker with his drugs a little bit, as they were all stopped on his previous admission. On exposure, he had pitting edema up to his sacrum. He's seen a doctor who's coming back to review him again, and we would also like you to come along and review him. His news is getting higher and higher.
Right, yeah. What's his SATs now?
SATs are steady at about 90 to 92. They're a bit variable.
And that's on a non-rebreathe, you said?
That's on the 15 litres, yeah.
Yeah, he sounds really poorly. Definitely sounds like a heart failure type picture. But have you got a doctor there?
He's on his way.
On the way, okay. Right, well, I'll be there in about 5 minutes. If you can just repeat
Lovely.
a set of obs for me, please, that'd be
Of
awesome.
course, yeah. No problem. Thanks very much.
Okay, thank you. Cheers.
See you
Bye.
soon. Bye-bye. Wes, can we get this oxygen mask back on you, mate? It's going to help. I promise you, I won't do anything that's going to hurt you. I'm going to get the doctor come and see you in a minute. Come on, mate, please. Hi, Doc. So this is Wes. It's a gentleman that I was telling you about. He's got heart failure. He's got AF. He's really struggling with his breathing. I've done an A2E, but after I finished that, I thought you should definitely see him. His news is going up and up.
Yeah. Okay. Has he been putting anything up?
Yeah, so basically some sort of blood stain from his sputum if you want to have a look.
Oh yeah.
Yeah, exactly. So yeah,
So you'll be alright.
I don't know how long that's been going on, but he was in hospital last week with a similar sort of thing, but not quite as bad as this. Is that right? So
Yeah.
Okay.
But he's had enough really. He's not letting me put the oxygen on. And
Okay. Right. I'm Dr. Bashir. Okay. So what I'm going to do is I'm just going to do a quick assessment. If this is your dad, is that right?
Yeah.
Okay. And we'll take it from there. Okay. So
Just do what you can. Do what you can, please.
thanks. If you need anything, just I'll stay here and you
Will
can.
do. Okay. Hi, Wes. Hello. So I'm Dr. Bashir. Okay. I'm just gonna do a quick assessment of you. Okay. Just dot the I's, cross the T's, make sure everything's okay. All right. Can you tell me what's been happening?
Wait with me. I don't want to.
Okay. You sound a bit fed up there.
Yeah, I don't know.
Yes. Oh, sounds like you're having a terrible time. All right. I'm just going to do a quick assessment, as I say. Just going to have a listen to your chest, okay? All right. Okay. Just don't mind me. All right.
Doctor won't tell. We don't want to mess you about. You gonna have a sip of water, Wes? Drunk much today?
Can you help me sit him? Oh, sit him forward.
Yeah, sure. I'm just gonna pop you forward a little bit. Remember, like I did earlier. Yeah, you can just places. So
Yeah, it is.
I've just done my clinical skills, so
Yeah, definitely. It's okay. And just while I'm here, and I've got the stethoscope, I'm just going to listen to your heart, okay? Okay, what was it, SATs?
SATs. Oh, hang on, 87. Yeah. So we started them on 2 litres, but then we came back again, and they were only at 90. So we started them on 15 while I did an A2E. Well,
Okay, can we get this back on, Wes?
Tom, Wes, it's going to do you good, mate. Can we put the nose one on? Would that be all right?
Just try the nose one, yeah? We need to get your oxygen levels up a bit. Okay.
We're listening to you, Wes. Don't worry, we're listening to you.
What if he holds this here for now?
I'll just keep it hold it nearby, all right? You don't have to have it on your case.
I'm just going to check a couple of things, all right? Yeah. It's racing.
Yeah, he's a regular as well, I think.
Yeah, it is. Yeah. All right. Okay, right. Don't mind me. I'm just going to have a press here.
You're doing great, Wes.
About 2.
Yeah.
What was his blood pressure?
155/90.
Okay. And I'll just have a check.
Yeah, so that's one of the other issues I noticed. Well, the healthcare said that's not been emptied all day, so he's passed virtually nothing.
Okay, fine. Right. Okay. How much has he been drinking?
Really, I mean, I tried to wet his whistle. He didn't really want to do that.
Okay. Well, he's got access. I see. Is that's
Yeah.
Okay. Right. I think we need to give him fruitamide 40 milligrams.
Yeah, he's got an AKI, you know.
Yeah, I appreciate that. At the end of the day, he's very overloaded, and I think we've got to offload. I think that's going to cause more.
All right. Okay.
So.
What do you want? 40?
Yes, 40, please.
Yeah. No worries.
Right.
Do you want anything else at the moment?
I can see good Josh. I'll just stop one extra.
I won't get that.
Okay. Can I just have a little look in?
Is everything really okay?
Well, his heart sounds like it's been misbehaving. I'll finish my assessment and I'll give you a bit more of a thorough information. Just have a little look in your eyes, okay? Can you just look ahead for me? Just have a little look in the light. Have a look. Yeah, just stare at the light. Okay, sorry, I know it's uncomfortable. Just open your eyes a bit. Have you got any pain anywhere?
We'll just take this, my friend. Don't worry. I'm just going to have a little look.
Can you do me a
Give you
favour?
some
Can you just
medicine.
squeeze my fingers? Yeah, okay.
That's it. Well
Look at
done.
me. Can you just do this with your face? Just smile like that for me.
You're doing great.
Okay, sorry. Sorry to ask you to do
That's
these
it.
daft things.
All done. That wasn't too bad, was it?
Okay. You got no pain anywhere? No any pain? No. Okay, right. Just have a little look just down here a bit, okay? What was his BM?
BM7.
So
that's normal.
Lymphedema.
Yeah, and it goes all the way up to the sacrum, I'm afraid.
Yeah. Can I just see you forward? Do you know? Oh, do you know what? It's fine. We'll have a look later. Okay. I just think that he's going to have circle anyway.
Yeah.
So, okay. Right. Okay. You look very fed up. Well, I can understand why. It looks like your heart's kicking off a bit, Wesley. I just grab a chin. I'll just explain what's been going on. Your heart's misbehaving, okay? All right? Okay? It's not doing what we want it to do. It's heart failure, okay? All right? So what we need to do is we need to maybe tweak your medications a little, okay?
I don't want it.
I know, but these treatments will help you, okay? They should make you feel better. Yeah?
I just don't want to go on anymore.
Dad, stop saying silly stuff like this.
I'm ready to go.
Has it been saying this a lot?
No,
Has you been confused at all?
no, he's never confused.
Quite with it mentally, yeah.
He's always there. It's just, he's not in the right state of mind at the minute. I can tell. I just know.
Right.
This isn't him. He wouldn't make a decision like that.
Okay. I'm sorry you feel that way. Yeah. Can you do? I just need to do a few quick, simple questions, if that's all right. They're going to sound stupid. It's just so I know that we're all on the same page with things. Okay. First of all, can I just check your name? Can you tell me your name?
Wesley.
And what's your date of birth, Wesley?
It's 9, 6, 45.
Okay. And do you know what day it is?
Wednesday today.
Wednesday. And last question from me for now. Do you know where you are?
In the hospital.
Yeah.
Okay.
Okay.
I don't want to do it anymore.
I know.
Wesley, you do know, don't you, that if we can't treat you, your heart's going to get worse.
I'm ready to die. I'm ready to go.
Oh, stop! You need to stop saying stuff. Like that. That's silly. You're not ready to die. You're ready to go back home. That's what.
Yeah.
We're not. No.
Wesley, you need to understand that if we don't treat you, you could have a cardiac arrest. Your heart could stop. Are you saying you don't want that?
I don't want to.
No. This is. I'm not gonna let this. I'm sorry. I'm not gonna just sit and let this happen.
It sounds like he's got capacity.
Capacity. What is capacity?
That means he can
It sounds like he.
make his own decisions for himself because, as you were saying, he's not confused normally and isn't now, but he's just distressed because he's been in hospital so
So
much.
what? Is this just an attempt to just give up? This is what that is.
Certainly not. Absolutely not. What we need to do is to make sure that he is comfortable first of all. Okay, and our main concern is to make sure that we listen to him and we need to take his wishes into account. Okay, but that doesn't by any means that does not mean we're giving up. And in fact, if things change and if your dad changes his mind about things, we can always review things, okay? But he sounds like he's really had enough, you know?
But now it's his decision as he doesn't want treatment, so we can talk about that if you want to. But really, in the event of him having a cardiac arrest, we're thinking about not resuscitating him because we wouldn't get a good result from that. I'm sorry, I know this is really hard.
Wesley, what if we put a little needle just under your skin and just made you comfortable?
These are medications that are going to help your symptoms, but it's not.
I'm ready to go.
Okay.
I'm ready.
It is Blake, isn't it? Blake. Okay. Do you understand where I'm coming from?
Yes. I can't lose my dad. I can't. I have no one. I have no one.
He's been struggling for a long time now, Blake, hasn't he? He said in the hospital quite a few times this year.
But I just don't get it because he always just bounces back to who he was before.
But I think we've reached the stage where we need to just keep him comfortable.
Did someone get that?
I think I need some fresh air. I think this is actually the break. We can talk about it whenever you want to.
Let's review these medications and see if we can go from
Okay.